Well, you know those treat bags are going to be full, so you can have your candy and keep your healthy teeth too.
All right.
That's the question.
Yes. Dentist Nina Baghaie is here with answers. Dr. Baghaie is with Hudak Dental. This is very timely.
Yes,
we need your help.
Because there's going to be a lot of chocolate tonight. I'm sure. In some way, shape, or form, right?
So obviously we know sugar is bad for our teeth, but what does it actually do to them?
So we've got lots of bacteria that are naturally in our mouths, and these bacteria require sugar to live. And when they live, they actually produce the acid that causes cavities in our teeth. So I'm sure with any Halloween candy, we want to be very careful with how much sugar we're putting in our mouth to give to those bacteria, because this is the #1 time of the year where you see most of those cavities start to begin.
Really?
Yes.
So it kind of coordinates with the time. That's interesting. That really
downward fall.
Well, okay. Well, we have some pictures to show you, and it's always interesting, I think, to take a look at what happens and for you to explain. So these are pictures of how you've treated teeth that have been affected. Tell us about what we're looking at here.
All right, so in that first picture, you don't have to be any sort of doctor to see there's a tooth in there that has a big dark area in it. And what that shows is a cavity that's gotten pretty deep, and it's actually entered the nerve. So if you look towards the pointy part of the tooth, there's a little bit of a shadow. And that tells us the nerve has been infected and needs to be cleaned out.
Ow.
Mommy.
So what you're seeing in that second picture is a tooth that's been treated with a root canal and a pretty large filling, and soon enough it's going to be getting a crown.
Okay.
I hope all you children out there are watching this.
Right. But I mean, is it really painful these days at the dentist? Because those that are watching, and there's...
It's not really.
Okay.
I mean, we give you anesthetic. There's always laughing gas as an option, but it's just one little pinch and then you won't feel anything for the next few hours.
So there are ways, obviously, that we can protect ourselves. Well, we can enjoy our candy, but what would you recommend? So
I know it might be hard, but you always want to limit the candy as close to meal times as possible. And, 1 piece a day, brushing and flossing. It's really, really important to floss. String is better than the floss picks, because the string, you can go ahead and make those C's to hug the teeth, and that's how we make sure they stay nice and clean.
Interesting. Is it one of those that you have a piece of chocolate and you should be running to the restroom to brush your teeth? I mean, is that how it works if you really want to be?
As long as you're like brushing and flossing, like brushing twice a day, flossing at least once a day before bedtime, that should be good. When it comes to the candies, stickier candies, sour candies are going to be worse for your teeth.
Like the gummy
stuff. That stick.
Anything that you suck on, like a lollipop or a hard candy, that's going to be getting that sugar for a longer period of time in the mouth is something we'd worry about. Sour candies have an acid in them, which is very similar to the acid that those bacteria are going to produce.
Okay.
So you're going to want to limit those.
So chocolate?
Chocolate's okay.
It's the way to go.
Chocolate too.
It comes from a cocoa bean. It's technically a vegetable.
Yes, this is true, Holly. So, question for you, because I always Listerine throughout the day. So if I have a piece of candy, I feel like, I'll just Listerine and everything will be fine.
Of the stuff out of
Does that do anything?
I mean, it can make your mouth feel nice and fresh, and I'm sure it decreases some of the bacteria that are there.
Probably some of the bacteria.
But the brushing and flossing is a surefire way to make sure everything is cleaned.
All right.
Okay.
We have more pictures to show you, so we're going to put those up. Tell about what we're seeing here.
Okay, so if you're looking at these pictures, you see the shadows again. What you might notice is that this one isn't quite as bad as the other picture. So in the first picture, we see 2 teeth that got cavities in between the teeth, and that's what we call a kissing lesion. And in the second picture, those teeth have been filled.
Very interesting.
Okay, and then I think we have, here we go.
So for all you parents out there, I'm sure you'll be looking in your child's mouth. In that first picture, where we see all that black stuff on the teeth, that shows that there's a cavity there. So when you go to the dentist and you get your teeth cleaned and you see someone poking and feeling around, we're feeling for those dark spots to see if there's a catch or if they're sticky.
Right.
And then in that after picture, those are going to be teeth that have been treated and filled with a white filling material.
I love that white fillings
are the
choice these days. That's great.
Yes.
Wow, this has been very informative.
It has been, Doctor.
We know which kind of candy is, we should probably be eating more than other candies.
Let's get you all the information.
Yeah, here we go. Okay, so it's hudakdental.com.
Yes.
You can get in touch with Dr. Nina and some of her colleagues there. Thank you.
Thank you so much for being here today.
Of course, it's my pleasure.
And happy Halloween.
Yes,
thanks,
happy
you
Halloween.
too.
Okay, well, still to come, apple bobbing at its best. We're going to put Jollof.
Jollof, that's right.
To the test.
Okay.
Jollof.
That's right. And up next, last-minute costume ideas that are scary good. Stick around.
This segment of Live on Lakeside was furnished by Hudak Dental.